Today, we will discuss the fundamentals of quality management. In this training, we will take a slightly different approach from previous sessions and think together about the fundamental questions: what is quality? What is quality management? Thank you for joining us. Today's training is organized into 6 themes. 1. What is quality? We will reconsider the very definition of quality. 2. Differences between QC, QA, and audit. We will clarify these 3 commonly confused concepts. 3. What is audit? We will learn the true purpose of auditing. 4. What is a quality system? We will understand quality management as a company-wide framework. 5. State of control and continuous improvement. We will learn the mindset for maintaining and improving quality. 6. Importance of communication. We will consider how information sharing within the organization is essential for protecting quality. Let us begin with Chapter 1. What is quality? Let me start with a sudden question. Imagine you purchased a luxury brand bag for $1,000, and when you got home, you noticed a smudge on the buckle. How would you feel? Most likely, you would think, this is poor quality. Now imagine you bought a paper bag at a convenience store for $3, and it had the same kind of smudge. You probably wouldn't care much. The smudge is the same, yet our perception differs. By examining this difference, we can see the true nature of quality. What can we learn from the previous example? When the price was high, any scratches or stains lead to complaints. In other words, expectations and demands for the product are high. When the price was low, minor scratches or stains don't bother us much. Expectations and demands are relatively low. Here, 2 factors emerge: price and user requirements. In other words, the quality of a product is not determined simply by how well it is made, but by the standards that customers hold relative to the price they paid. Let us summarize an important point here. Quality is the customer's requirement standard commensurate with the price paid. And there is another crucial point. Quality cannot be determined by the producer. It is the customer who determines quality. No matter how much a manufacturer claims, this is a high-quality product, if the customer does not feel that way, it cannot be called good quality. In the case of pharmaceuticals, the customers are patients and healthcare professionals. Their requirement is improved QOL, which is virtually limitless. This is precisely why pharmaceutical quality management demands such exceptionally high standards. Let us clarify a commonly misunderstood point. Having high quality and assuring quality are entirely different things. So what is quality assurance? Quality assurance means being able to continuously produce according to predetermined quality and specifications. In other words, whether it is the first time, the 10th time, 1 year later, or 5 years later, you can keep manufacturing products with the same quality and specifications. This is the essence of quality assurance. Here is an important analogy: no matter how many convenience store paper bags you keep producing, they will never become Louis Vuitton bags. Quality assurance is not about continuously raising quality, but about being able to consistently produce to defined specifications. The international standard ISO 9000 defines quality as follows: the degree to which a set of inherent characteristics fulfills requirements. This may sound somewhat complex, so let us consider a blood pressure monitor as an example. Whether this blood pressure monitor is of good or poor quality depends on whether it meets the customer's requirements, such as accurately measuring blood pressure and being easy to use. The key point is that ease of use is not directly related to quality. The criterion for judging quality is strictly whether the requirements are met. What does it mean for quality to be good? It is the state in which the various essential characteristics of the product fulfill the requirements. Simply put, if the requirements are met, then the quality is good. However, one caution is needed: the user's requirements themselves may sometimes be incorrect. For example, in pharmaceutical manufacturing, a piece of equipment may be introduced thinking it would be adequate, only to find that it did not actually meet the requirements. This is why validation confirming suitability in the user environment is so critically important in the pharmaceutical and healthcare industries. Good quality and fit for purpose are separate concepts. This is known as fitness for purpose. Let me give you a rather extreme example. Suppose a scalpel was not available during surgery, so the surgeon purchased the finest knife from a nearby premium cutlery shop. The knife is of the highest quality, but can it be used for surgery? The answer is no. No matter how high the quality, if it is not suitable for the intended purpose, it is meaningless. Translated to pharmaceutical manufacturing, if the specifications of manufacturing equipment do not properly match the requirements of the product being manufactured, unexpected accidents can occur. Let me give you a more familiar example. You want to tighten a Phillips screw, but you cannot find a Phillips screwdriver. In fact, a flathead screwdriver can temporarily tighten a Phillips screw. However, if you keep doing this, the screw head will get stripped. Furthermore, the screwdriver itself may become damaged. It sort of works, or it works for now, does not constitute continuous quality assurance. Aligning specifications with intended use is of the utmost importance. Even a single wooden stick carries vastly different risks depending on how it is used. Used as an ice candy stick, the risk is low. Used as a tongue depressor, it makes direct contact with the human body, the risk is high. In other words, the risk changes depending on the intended use, and so does the required level of quality assurance. In pharmaceuticals, even when using the same manufacturing equipment, the level of quality assurance required for a vitamin supplement versus an anti-cancer drug or vaccine is entirely different. Quality management must correspond to the characteristics and intended use of the product.
Struggling with quality management system documentation? QMSdoc.com provides ready-to-use QMS templates for pharmaceutical and medical device companies.
Download compliant SOPs, regulations, and forms all in editable MS Word format. Customize them to fit your operations. Any QMS template is available at QMSdoc.com.
In Chapter 1, we learned about what quality means, that quality is the customer's requirement. Standard commensurate with price, that quality assurance means continuously producing at the same quality, and that fitness for purpose is essential. In Chapter 2, we will learn about the differences between QC, QA, and audit. Many people actually confuse these three concepts, so let us sort them out clearly today. Please look at the slide. QC, QA, and audit are entirely different activities. One particularly important point: both QC and QA departments are subject to audit. If you thought QA is the department that audits while everyone else is audited, that is incorrect. Both QC and QA departments can be on the receiving end of an audit. Let us examine the differences in detail from the next slide. First, the fundamental principle: quality assurance should be performed by the department itself. It is not something another department does on their behalf. Let us clarify the three differences. QC is the activity of managing quality by oneself, as typified by self-inspection. The basic principle is to control your own work. QA involves deeply engaging with the process and continuing operations while assuring quality. QA personnel must be experienced and knowledgeable in the relevant operations. As subject matter experts, they provide third-party guidance and advice while granting quality endorsement for the deliverables. The reason for maintaining a third-party perspective is to ensure objective judgment and to prevent becoming too familiar with the personnel involved, which would compromise appropriateness. Continuing with the differences between QA and audit. QA personnel do not need to be from a separate department. They may belong to the same department. What is important is that they can bear accountability to customers and regulatory authorities. This is why they are expected to provide advice on processes with a critical eye. On the other hand, an audit is when an independent department periodically or irregularly samples and investigates processes and deliverables. Audits are conducted after the fact. Let us clear up an important misconception: passing an audit does not equal quality being assured. An audit is a sampling investigation, it does not check everything. While auditing is one part of quality assurance activities, it is not the entirety. Let us now dive deeper into QC. Although it stands for quality control, what many companies actually practice is quality check. Control and check are different. What is control? A baseball analogy helps. A pitcher controls their pitches, aiming for the strike zone. QC means controlling processes, aiming for the quality strike zone. To illustrate, management is the role of the coach overseeing the players, control is the role of the pitcher actually throwing the ball. You are in the position of pitchers who perform your work according to SOPs. The quality strike zone is documented in standard operating procedures and product standards. Let me explain the concept of QC with a specific example. We outsourced data entry of 1,000 items to a vendor. The contract specified that we would accept up to 0.3% errors. When we started checking, we found an error at the fourth item. This exceeded 0.3%, so we cannot accept. We return it to the vendor. There are two important points here. First, you must not tell them where the errors were. Second, you must not tell them how many errors there were. Why? Because if you do, the vendor will only fix the pointed out locations and resubmit. Then you end up checking for the remaining errors yourself, effectively taking over quality management in a later process. By returning poor quality work, the vendor bears the responsibility to improve their own quality. This is true control. Here is another example from a cookie factory. The manufacturing instructions specify baking at 170 degrees Celsius plus or minus 5 degrees Celsius. The burner operator lowers the heat when the temperature is about to exceed 175 degrees Celsius and raises it when it is about to drop below 165 degrees Celsius. Exceeding 175 degrees Celsius causes burning upper limit deviation. Dropping below 165 degrees Celsius leaves cookies undercooked. This 170 degrees Celsius plus or minus 5 degrees Celsius range is the quality strike zone. By staying within this zone, delicious cookies of predetermined quality are consistently produced. If you follow the standards written in the SOP, products of the same quality can be stably produced. Conversely, if quality cannot be maintained even while following the SOP, it means the SOP itself is wrong. SOP stands for Standard Operating Procedure. The standard is like the strike zone in baseball. The procedures written in the SOP define the strike zone, and you control your work by aiming for that zone. Let me point out two problems commonly seen in some organizations. Problem 1: frequently modifying the SOP. Some companies loosen the SOP to avoid deviations. However, if the strike zone keeps changing, yesterday's work loses its meaning. SOPs should not be changed carelessly. Problem 2: including all exceptions in the SOP. If the strike zone is widened without limit, every pitch becomes a strike, and control becomes impossible. SOPs should be written with reasonable precision to maintain operational accuracy. What should you do when an exception arises that prevents you from following the SOP? First, the fundamental principle: if you include all exceptions in the SOP, it is no longer an SOP but merely an OP. The standard is lost. The proper exception handling procedure is as follows. 1. Document in the plan beforehand the reason why the SOP cannot be followed. This reason is called a justification. 2. Obtain review and agreement from QA personnel. 3. After QA personnel agree with the justification and give their endorsement, the responsible person approves the plan. What is important is providing a justifiable rationale, not an excuse. It requires demonstrating. In this instance, we are modifying part of the SOP for these reasons, but there is no issue with quality assurance. Next is QA. Does anyone think QA is just auditing, right? That is a misconception. What is assurance? It means that experienced and skilled subject matter experts guide, advise, and lead to success. Those who are inexperienced, unsuitable, or prone to mistakes. The role of QA personnel can be summarized as deeply involved in the process. Providing endorsement on behalf of the department and bearing accountability to customers and regulatory authorities. QA's greatest authority is the release decision. Furthermore, QA must be independent from the sales department to prevent quality compromises driven by revenue goals. Let me explain the meaning of QA's assurance with a relatable example. Imagine you are going to undergo LASIK surgery. The assigned doctor has only performed 100 surgeries, which makes you anxious. Meanwhile, the clinic's chief physician has extensive experience with over 10,000 surgeries. However, the chief no longer performs many surgeries personally. What would you want in this situation? I want the chief physician to be present, giving advice to ensure the surgery succeeds. That is precisely quality assurance. An experienced expert stands behind the newcomer, guiding them to success and endorsing the result. This is the essence of QA. Let us organize the roles of QA using a diagram. Correct approach: the QA department is deeply involved with the operating department. Understands the processes and is prepared to explain them to regulatory authorities. When a regulatory inspection occurs, the QA department explains on behalf of the operating department. Incorrect approach: the QA department delegates everything to the operating department and during inspections. The operating department faces the authorities directly. Without QA involvement, accountability cannot be fulfilled. Key points to remember: provide endorsement on behalf of the operating department. Maintain records of discussions with the operating department. Where marketing authorization holders and manufacturers are separate entities, Communication records between them are especially important.
Struggling with quality management system documentation? QMSdoc.com provides ready-to-use QMS templates for pharmaceutical and medical device companies.
Download compliant SOPs, regulations, and forms all in editable MS Word format. Customize them to fit your operations. Any QMS template is available at QMSdoc.com.
In Chapter 2, we learned about the differences between QC, QA, and audit. Chapter 3 covers what is audit. We will learn about the true purpose of audits and the concepts of conformity and validity as defined in ISO 9000. According to ISO 9000, audits are structured in 2 layers. Layer 1 system audit. This confirms whether your QMS, including SOPs and other procedure documents, complies with regulatory requirements such as ISO, FDA, and GMP ministerial ordinances. When there are no discrepancies between regulatory requirements and the QMS, it is said to have conformity. Layer 2 process audit based on a conforming QMS. This confirms whether actual operations are being carried out correctly and records are being created. When there are no discrepancies between the QMS and implementation records, it is said to have validity. Without first conducting a system audit to confirm the QMS is appropriate, auditing records alone is meaningless. This 2-layer structure is essential for proper auditing. Let us review Chapter 9 of PICS GMP on self-inspection. The chapter states conduct periodic self-inspections of quality management operations and create records of the results and report self-inspection results in writing to the quality assurance manager. Importantly, paragraph 2 states that when improvement is necessary based on self-inspection results, the quality assurance manager shall take required measures. These required measures refer to CAPA, in other words, improvement. The ultimate purpose of self-inspection is not to point out problems, but to drive improvement. In PICS GMP, Chapter 9 stipulates self-inspection. The purpose is clearly stated. Self-inspection shall be conducted to monitor implementation and compliance with GMP principles and to propose necessary corrective actions. In other words, the purpose of self-inspection is to propose corrective actions to promote improvement. Key requirements include verifying compliance with quality assurance principles and including proposals for corrective actions. Please remember that self-inspection is not merely a check, it is an activity premised on improvement. The common objectives of internal audit across FDA, PICS, and ISO can be distilled into just 2. 1. Verification of QMS conformity, confirming that the QMS complies with regulatory requirements. 2. Verification of QMS effectiveness, confirming that the QMS is effective and capable of continuous improvement. Let me share an important insight. If you find a transcription error or calculation mistake during an audit, what should you write in the audit report? Many people would write, "There was an error in XX. Please correct it." However, this misses the purpose of auditing. The correct approach is in this process, an error went undetected and uncorrected. This indicates that the QMS lacks effectiveness. We propose improving this section of the SOP. Auditing is not about pointing out individual errors, but about identifying systemic issues that allowed errors to go undetected and proposing improvements.
Struggling with quality management system documentation? QMSdoc.com provides ready-to-use QMS templates for pharmaceutical and medical device companies.
Download compliant SOPs, regulations, and forms all in editable MS Word format. Customize them to fit your operations. Any QMS template is available at QMSdoc.com.
So far, we have learned about quality, QC, QA, and auditing. Chapter 4 covers what is a quality system. We will learn about the overall framework of the Pharmaceutical Quality System, which was formalized through ICQ 10 and adopted by PICS member countries. ISO 9001 is an international standard that defines quality management. Note that in some languages, the terms for quality management and quality control share the same translation, which can cause confusion. ISO 9000 defines 2 distinct concepts within the quality management system. A. Quality management coordinated activities to direct and control an organization with regard to quality organization-wide quality management. B. Quality control part of quality management focused on fulfilling quality requirements. Quality management at the individual process level. Note that in some languages, management and control may share the same translation, leading to confusion. In English, these are distinct concepts. In more practical terms, Quality management is a system of means for economically producing goods or services of quality that meets the buyer's requirements. Specifically, the goods and services provided to customers must meet their required quality, cost, and delivery. Importantly, quality management is not something only the manufacturing department does. It must be promoted across all departments from market research, R&D, development, manufacturing, inspection, shipping, sales, and after-sales service. Quality management includes both narrow quality management and broad quality management. Narrow quality management focuses on departments related to product manufacturing, such as manufacturing, quality control, production engineering, and purchasing. Broad quality management encompasses company-wide quality management activities aimed at meeting the quality demanded by customers and society. Today, broad quality management is mainstream. ISO 9001, TQM, and TQC all fall under broad quality management. Many countries have adopted TQM and TQC approaches to produce world-class quality products. The challenge is to leverage organizational strengths while also adapting to global standards. This slide illustrates the relationship between QM, QA, and QC using concentric circles. The innermost circle is QC. Surrounding it is QA. The outermost circle is QM. Note that since ISO 90012000, the QM circle has expanded significantly. Management responsibility for quality has been strengthened. It is now clearly required by international standards that management should not make business decisions based solely on economic reasons. They must also take responsibility for quality. Let us confirm an important structural point. Regulatory requirements are issued to the top management of pharmaceutical companies, not to employees. If you read PIC's GMP and EU GMP directive, the requirements state, the manufacturer shall. It does not say employees shall. In other words, the obligation is placed on management. The flow works as follows: management creates the company's policy based on regulatory requirements. Management ensures thorough dissemination of this policy to all employees. Employees comply with their company's quality manual rather than directly referencing regulations. This is called corporate governance. Let us examine the PDCA cycle in ISO 9001, 2015. At the center of the quality management system is leadership. The PDCA cycle revolves around it. Plan setting quality policies and objectives, preparing necessary resources. Do actual manufacturing, shipping, and service delivery. Check performance evaluation using metrics such as complaint counts, deviation counts, and customer satisfaction. Act implementing CAPAs based on evaluation results and improving the QMS. By continuing to rotate this PDCA cycle, quality improves day after day. This is what the quality system aims to achieve. Management is responsible not only for establishing quality policies but also for appropriately allocating people, materials, and funds to achieve them. This slide shows that the PDCA operates at two levels. The outer, larger PDCA represents the company-wide quality management cycle. The inner, smaller PDCA represents the cycle at the individual operation and process level. When both PDCA cycles function well, quality across the entire company continuously improves. Data obtained from the frontline PDCA is reported to management, and this feeds into next year's planning and resource allocation. This flow constitutes a healthy quality system. This slide shows the overall structure of a quality system. A quality system consists of four main processes. 1. Management process from business policy to quality policy setting, objective management, QMS planning, and management review. 2. Resource process securing and developing human resources, infrastructure, and training. 3. Development process the product lifecycle from research, development, manufacturing, storage, to distribution. 4. Effectiveness improvement process complaint management, CAPA, monitoring, and internal audit. Starting from customer requirements, products generate customer satisfaction, and that feedback loops back to the management process. This entire framework is the quality system. In the pharmaceutical industry, ICQ 10, adopted by PIC's member countries, mandates the construction of such quality systems.
Struggling with quality management system documentation? QMSdoc.com provides ready-to-use QMS templates for pharmaceutical and medical device companies.
Download compliant SOPs, regulations, and forms all in editable MS Word format. Customize them to fit your operations. Any QMS template is available at QMSdoc.com.
In Chapter 4, we learned about quality systems and PDCA. Chapter 5 covers state of control and continuous improvement. We will explore why maintaining a state of control is essential for quality maintenance and improvement through concrete episodes. Are you familiar with Heinrich's Law? Proposed by American safety engineer Herbert William Heinrich, this law states behind one major accident, there are 29 minor accidents and 300 near misses, also known as the 1:29:300 ratio. Applied to the pharmaceutical industry, behind one major quality incident or recall, there are 29 minor deviations and 300 near misses or small quality problems. To prevent a single major accident, it is essential to be sensitive to daily small quality problems and address them early. Let me share a tragic real-world example of Heinrich's Law. In March 2005, an explosion at BP's Texas City refinery in the United States killed 15 workers and injured over 170. In the years leading up to the disaster, the refinery had experienced numerous safety incidents and near misses. Internal reviews had identified over 300 safety concerns that remained unaddressed. According to Heinrich's Law, a major accident could have been predicted from the pattern of minor incidents. Yet adequate countermeasures were not taken, and the worst outcome occurred. The same applies to quality management. Ignoring minor deviations and near misses eventually leads to major incidents and recalls. The broken window theory demonstrates the importance of a state of control. Professor Philip Zimbardo's experiment is well known. A car was abandoned in a suburb. Even with the license plates removed and the hood open, nothing happened for a week. However, after the windshield was broken, within 10 minutes a parent and child took the battery, then the tires were stolen, graffiti was added, and within a week the car was completely destroyed. This shows that when people feel something is not being managed by anyone, they feel less guilt about looting or destroying it. In quality management, if an atmosphere spreads that no one cares if we don't quite follow the SOP or minor deviations will be overlooked, moral hazard occurs and quality deteriorates. This is why it is crucial to always maintain a state of control. Let me introduce two success stories where this theory was put into practice. New York City's crime recovery in the 1980s. New York's subway was covered in graffiti and crime was rampant. Mayor Giuliani started by erasing graffiti. Beginning in 1984, by 1991 most graffiti was removed and crime began to decline. By 1994, violent crime was cut in half. By addressing minor issues first, major crime was deterred. London Metropolitan Police Initiative adopting the broken window theory. London's Metropolitan Police began with a thorough crackdown on minor offences in high-crime boroughs. Antisocial behaviour incidents decreased by 1/3, and overall crime rates dropped measurably. The same applies to quality management. Rather than only pursuing major incidents, being sensitive to daily small quality problems and accumulating improvements is essential. Are you familiar with the boiled frog phenomenon? If you throw a frog into hot water, it will jump out in surprise. But if you place it in cool water and gradually heat it, the frog will not notice the change and eventually be boiled alive. Humans tend to become insensitive to gradual environmental deterioration. In quality management, even as quality slowly degrades day by day, people become accustomed to it and fail to notice. By the time they do, it may be too late. This is the boiled frog phenomenon. This is precisely why maintaining a state of control and not overlooking the 300 near misses and 29 minor incidents is essential. Kaizen is a continuous improvement concept originating from Japan, now recognized worldwide. Why did Kaizen become a global term? In the 1970s, Japanese automobiles gained significant market share in the United States. They were cheaper yet had fewer breakdowns and better fuel efficiency. Feeling threatened, the big three U.S. automakers thoroughly studied this quality management approach and discovered Toyota's Kaizen system. This Kaizen concept was researched and systematized in America, becoming Kappa, which was adopted into FDA's GMP and international standards such as ISO 9000. Kappa can be said to be a system that originated in Japanese manufacturing culture and was formalized into a global standard. Management methods differ fundamentally across organizational cultures. Western management is top-down. Managers check their subordinates' work based on SOPs. SOPs exist not for frontline workers but for managers to manage. Just as no one reads a driving manual while driving, SOPs are tools for management and education. Some organizational cultures employ bottom-up management. Groups compensate for each other through strong networks. Some organizations have historically achieved high quality even when SOPs were somewhat ambiguous. However, from the perspective of regulatory authorities such as the FDA and PICS inspectorates, you say you have quality management but without documented procedures or systems, we cannot trust that, hence the need to adapt to global standards. In the pharmaceutical industry, implementing a quality system based on global standards is essential. However, the reality is that once Kaizen was systematized into Kappa, many organizations worldwide have struggled with implementation. Regulatory authorities have observed that many organizations still do not fully understand Kappa. This is because bottom-up improvement cultures do not always easily adapt to systematic top-down frameworks. Nevertheless, going forward, it is essential to build globally accepted quality systems properly. Creating SOPs, maintaining records, and systematically verifying conformity and validity. Rather than clinging to familiar methods, it is important to maintain the perspective of quality management that meets global standards. The key to the pharmaceutical quality system is the continuous improvement cycle of corrective and preventive actions. Plan, do, check, act. At the core of the act phase is Kappa corrective action addresses preventing recurrence of problems that have already occurred. Preventive action addresses preventing problems risks that have not yet occurred. By continuously rotating this cycle, organizational know-how accumulates and quality spirally improves. When a company has built a quality system but quality is not improving, the cause is typically either that Kappa is not functioning or that the internal audit lacks competence. Ensuring Kappa functions effectively as the driving force is the key to a healthy PDCA cycle.
Struggling with quality management system documentation? QMSdoc.com provides ready-to-use QMS templates for pharmaceutical and medical device companies.
Download compliant SOPs, regulations, and forms all in editable MS Word format. Customize them to fit your operations. Any QMS template is available at QMSdoc.com.
We have reached the final chapter. Chapter 6 covers the importance of communication. To protect quality, information sharing within the organization and a culture that encourages reporting are indispensable. In this final chapter, we will discuss the importance of communication, which is often overlooked in quality management. It is crucial for management to consistently demonstrate to employees the importance of complying with laws and regulations. When management holds this stance, rapid response becomes possible when problems arise or quality defects are discovered. In recent regulatory inspections, the primary focus has been on whether the quality system is functioning properly. It is important that the quality system is applied to individual products and that the framework operates as intended. Furthermore, when on-site personnel notice quality anomalies, it is critical that this information reaches management and is shared across the organization. By sharing information as an organization, necessary countermeasures can be implemented swiftly. Communication between marketing authorization holders and manufacturers is also extremely important to avoid deviating from approved matters. Both parties must maintain close coordination at all times. But are we truly fostering a culture where reporting is easy? People inevitably make mistakes and forget things. But if they report a mistake to a supervisor, they get scolded. Not wanting to be scolded, they hide it. They tell a small lie to cover it up. Then a bigger lie to cover that one. By the time it is discovered, it has become a problem too large for anyone to handle. This is how things typically unfold. To prevent such situations, regulatory authorities strongly require that management consciously foster a culture where anything can be reported easily. International standards such as ISO 9001 and data integrity requirements also clearly state the importance of communication. Here is a paradigm shift to consider. Those who report their mistakes should be praised. Why? Because they have provided an opportunity for improvement. People inevitably make mistakes. What matters is not blaming the individual who made the mistake, but improving the system, so that mistakes are less likely to occur and can be detected early when they do. It is because someone reported the mistake that we can improve the system. Therefore, the reporter should be thanked and recognized. The consistent message throughout today has been this: the essence of quality management is not blaming people for their mistakes. but properly building, operating, and continuously improving systems. Please put this into practice in your daily work report. Even small problems including near misses, communicate, and drive improvement. Thank you very much for participating in Pharmaceutical Quality Training Session 1 Fundamentals of Quality Management. Let us review the key points we learned today. Quality is determined by the customer. Quality assurance means continuously meeting requirements commensurate with price. QC, QA, and audit are each different activities and should not be confused. The purpose of auditing is not to point out errors but to propose systemic improvements. Quality systems are continuously improved through PDCA. Maintaining a state of control and never overlooking small problems is essential. Fostering a culture where reporting is easy and valuing communication is the foundation of quality. We look forward to building on today's content in future training sessions for deeper learning together. Thank you for your attention.
Struggling with quality management system documentation? QMSdoc.com provides ready-to-use QMS templates for pharmaceutical and medical device companies.
Download compliant SOPs, regulations, and forms all in editable MS Word format. Customize them to fit your operations. Any QMS template is available at QMSdoc.com.